Welcome to The Explainer. Today, we're diving into the science behind one of the most common and, let's be honest, frustrating types of back pain out there. I bet a lot of you know this feeling all too well. That debilitating pain that starts in your back and just shoots right down your leg. It can feel sharp, it can burn, sometimes it's like a little electric shock.
And if that's you, you are definitely not alone. One of the main culprits behind this is a degenerative condition of the spine, and it affects nearly a third of all older adults.
Okay, so let's get into it. What is actually going on inside your back that's causing this very specific and very nasty kind of pain? Well, the clinical term for it is sciatica. And here's the key thing, the real dead giveaway. The pain in your leg is actually worse than the pain in your back. That is a classic sign that a nerve root is getting pinched.
So what's causing it to get pinched? A lot of the time, it's a condition called lumbar spinal stenosis. As we get older, the channel in our lower back, where the nerves pass through, can actually start to narrow, and that puts pressure on them. You can kind of think of it like a traffic jam for your spinal nerves, and it gets way worse when you stand up or walk around.
So you get the diagnosis, and now what? You're basically standing at a crossroads of all these non-surgical options, and frankly, it can be totally overwhelming trying to figure out which path is the right one to take. Well, to help clear things up, a major clinical trial recently put 3 very different approaches to the test, head-to-head. The first was standard medical care from a physiatrist, that's a doctor who specializes in this stuff. The second was supervised group exercise classes. And the third was hands-on manual therapy plus personalized exercises from a physical therapist or a chiropractor.
So, the big question, which one actually worked? Let's dig into the results and see how these 3 paths stacked up for achieving that one main goal, reducing pain and getting you moving freely again.
Okay, now this is really interesting. In the short term, there was a clear winner. At the 2-month mark, the hands-on manual therapy group was way out in front. 20% of those patients felt a meaningful improvement. That's more than double the medical care group and, get this, almost 7 times better than the group exercise class.
But, and this is a huge but, here's the twist. That big early lead for manual therapy, it completely disappeared over time. By the 6-month follow-up, it was a dead heat. The rates of improvement were pretty much the same across all 3 groups. The gap just closed.
And this right here, this is the most important takeaway from the entire study. Even though no single approach was superior in the long run, patients in all 3 groups were able to walk a lot farther. So what does that tell us? It suggests that it doesn't matter so much which path you take, as long as you stick with a non-surgical plan, you're going to see real lasting gains. So while manual therapy might get you relief the fastest, consistent effort in any of these is what leads to long-term improvement. Speaking of fast relief, that brings us to one of the most common treatments people go for, those epidural steroid injections. So how do they really stack up against everything else? Well, a huge analysis of a bunch of studies confirms the pattern we've been seeing. As you can see here, injections are definitely more effective for short-term pain relief, within the first 3 months. But when you look at long-term relief or just being able to function day to day, there's no real difference compared to other conservative options like physical therapy. The takeaway is pretty clear. Injections can be a fantastic bridge to get you through a really bad patch of pain, but they aren't a long-term fix for the underlying problem. So what this is all really pointing to is a shift in how we should think about this. The science is telling us to look beyond just chasing that immediate pain relief and instead to focus on building a real, sustainable, long-term strategy for our back health. And this brings us to this central trade-off you really face when you're making a decision. You basically have a choice between treatments that can offer faster but often temporary pain relief and strategies that build lasting improvement over time, like consistent exercise. Neither one is right or wrong, but you need to know it's a trade-off you're making. And if we're going to talk about long-term health, we have to talk about prevention. To protect your back, the research points again and again to a few key things you can actually change. For example, things like smoking and obesity. They increase inflammation all over your body, which can just make back pain worse. And then you have jobs with heavy lifting or just standing all day. Well, that puts direct, repetitive stress right on the spine. So at the end of the day, the evidence really suggests that there is no single magic bullet. The best path forward comes from asking yourself this one simple but powerful question. What's your main goal right now? Is it to feel better immediately? Or is it to build a stronger, more resilient back for the years to come? The answer to that question is what will help you and your doctor choose the absolute best strategy for you.